Undertaking an intramuscular injection. Step 1. Identify the reason why you are giving the injection.
This is Thorne Forrester. He is having metoclopramide because he's been nauseated.
Identify the 6 rights on the medication chart.
Okay. I have the right patient, which is Thorne, the right medication, which is the metoclopramide, the right route, which is intramuscular, the right dosage, which is going to be 10 milligrams, the right frequency, which will be 6 hours and hasn't been given, the right documentation, that means that our doctor has signed.
And what does PRN mean?
PRN means that it can be given whenever it's required, within the 6-hourly time limit.
Does the patient have allergies?
I will need to go and ask the patient that. According to this medication chart, he is allergic to amoxicillin.
So can he have metoclopramide?
Yes, he can.
Okay. Step 3. Gather your equipment. You will need an injection tray, a 3ml syringe, a 21 gauge needle for drawing up the medication, a 23 gauge needle for injecting the medication, an ampule of metoclopramide, and an alcohol swab. Step 4. Calculate the dose of medication you to administer. On your assessment, you will show the correct calculation. Step 5. Wash your hands before beginning the procedure with an alcohol hand rub. Step 6. Assemble the equipment, maintaining an aseptic technique. You can either swab the top of the ampule to remove the medication or remove the lid of the ampule completely to withdraw the desired volume. For this you are giving 10 milligrams, which is 2 mils. Ensure you don't contaminate the needle while drawing up the medication. It's good to do this at eye level so you can clearly see the volume you are drawing up. Remove the needle and attach the injecting needle. Ensure you have the correct volume. Ensure there is no air bubbles. 2 mils, no air bubbles. Step 8. Check the medication dose and expiry date with the registered nurse against the drug chart.
Okay. So we have metoclopramide, which is metoclopramide here.
Bring that over here.
Sorry, metoclopramide. The dosage is 10 milligrams in 2 mils. My dosage is 10 milligrams. The expiry date is the 1st of the 1st, 2015.
Okay,
and here is my 2 mils.
No air bubbles? That's
No
correct.
bubbles.
Go to the patient bedside. Ensure privacy before you reveal the patient. At the bedside, check the patient ID with the RN. It will normally be on the patient's wrist.
Okay, we have here Thorne Forrester, and his UR number is 457006. You allergic to anything that you know of, Thorne?
Yes, amoxicillin.
All right, thank you.
Explain the procedure to the patient.
Thorne, I'm going to give you the metoclopramide injection for your nausea. I hope that's all right.
That's fine.
All right, I'm going to place the injection into your left thigh. Is that all right?
Yes, thank you.
All right.
Locate the injection site and assess for signs of scarring, burns or infection. Wash your hands. Wipe the site with the alcohol swab in a circular motion from inside to outside, clean to dirty. Hold the skin taut to flatten the subcutaneous tissue and inject at a 90-degree angle. Aspirate the plunger to ensure you are not injecting into a blood vessel, and then slowly inject over several seconds until medication has been fully injected. Remove and place in the injection tray. Do not recap the needle. Swipe the area with an alcohol wipe or a cotton bud. Check for bleeding and apply pressure if there's any bleeding. Dispose of equipment in the sharps container. Remember, do not recap your needle. Document the procedure on the patient notes, the time, dose, and your signature and the signature of the RN. Wash your hands and return to check the patient response. And he looks very comfortable with no nausea or vomiting. This is the conclusion of an intramuscular injection.